would like to read a bio of our next speaker, Anthony Boyd, which I had a pleasure of meeting him on many occasions. Anthony Boyd, Detroit native, is a dedicated community organizer, an outreach specialist who works tirelessly to empower at-risk youth and advocate for systematic change. He is a United States Air Force veteran who combines discipline and compassion in his work. Drawing on his lived experience and a robust educational foundation, including an assistant degree in computer information systems for Jordan College, as a certified trainer in how being trauma-informed improves criminal justice system responses. He provides tools to help criminal justice professors respond with greater empathy and understanding, particularly towards those impacted by trauma. Attorneys work emphases, culture sensitivity, and restorative justice, aiming to address the root cause of system inquiries of improved outcomes. To magnetize communities, he has facilitated programs like the Veterans Impact Group and collaborated with academic leaders, including Dr. Tony Gasnew, to provide meaningful educational opportunities for incarcerated individuals. Anthony has been a leader in organizing like HOPE, Help Other People Involved, and National Lifer of America's Chapter 125. So with no further ado, when I bring this brother up, give him your full attention and welcome.
This on? Okay, it is on. Thank you. First of all, let me say thank you all for showing up. Sheba, thank you for inviting me or telling me to come here. So I came. Tonight, well, good evening, everyone. Thank you all for being here because I consider this to be an important discussion, especially when it involves harm reduction, it involves mental health, and it involves substance use. All of the things that I've experienced, well, I didn't experience substance use directly, but indirectly, I've been involved in all of it. And one of the things, just to give you an idea about me, like this gentleman here, I'm formerly incarcerated as well. I spent 23 years in the federal system and in the Michigan Department of Correction. It was there that I found out something was wrong. I didn't realize what it was then, but when I got home, that's when I discovered I had PTSD, depression, I had anxiety, and what I found, another thing that I looked at was, where did it come from? Because I didn't know. But when I started looking at things that was happening in my family, like my mom, which is what brought me here today. Sheba, I didn't tell you that, but yeah, I did. What brought me here today is my mom's birthday. And my mom passed in 2010, and I was incarcerated, and they wouldn't let me go. So I never got a chance to say goodbye. So I love you. So I wanted to come here because this was important, because my mother suffered from substance use issues, and she suffered from mental health. At the age of 12, she was raped by two of my grandfather's friends, and she never got help for it. So I wondered, why did my mother leave home so early at the age of 16 and married my dad when he was 21? But after I discovered that, I knew she was just trying to go somewhere where she thought it was going to be safer than where she was. And my grandfather was a jerk, simple as that. And for me, once I learned that I also, it made me think about what I had been through. And that's when I discovered being, having mental health issues myself as a young child, because we never taught that we can have those at a very young age. I just thought things were normal. The killings I was seeing, I thought that was normal. I didn't only see him at home, I saw him in prison. And in prison, that's when I found out I took a lot of what I took into prison a lot of what I learned from home. The first murder I ever saw was from home. And that was at 8 years old. And I just thought it was normal. But one of the other things I want to discuss is why this work is so important to me is because so many family members of mine have been involved in mental health issues. I just lost a brother not too long ago. He was diagnosed schizophrenic, bipolar, and he overdosed. And I carried Narcan and couldn't even get it to him because I didn't know he wouldn't tell anyone that he was suffering. And this particular thing is what got me involved in this work and working for Echo Detroit, which is a nonprofit. It's a nonprofit organization that it's like a subsidiary of Share Inc. And Echo Detroit is a recovery community organization. And I work specifically with people that's coming home from prison who have substance use issues and who deal in mental health. And I got to get this done because she was telling me that we're short on time. But one of the other things is what this panel's discussion is going to be about, this conversation in general, is a focus on the current landscape of those crucial issues, crucial areas, and the progress we've made, the challenges we still face, and where we need to go moving forward. And this will be discussed even further into tomorrow's panel. I'm thrilled. Okay, maybe not thrilled, but I'm okay. I'm glad to be here because of the people that's on the panel. I haven't had a chance. Two of the people I really don't know a lot about, but I've heard a lot about. One I know specifically, which is Aldeana Goodspeed. Aldeana was a navigator. I used to work for Michigan Liberation, and Aldeana was one of our hires. She was one of the first persons that I trained to become a navigator, as well as Z, St. James. And I've had the pleasure of being introduced to Dr., don't tell me. Okay, tell me. How do you pronounce your name again? That's it. So I'll let him say it so I won't mess it up. So I was introduced to him, and when I found out that he works down the street from where I work at, because you're at the Detroit Recovery Project, which is actually down the street from Share Academy, and Dr. Asabigi, okay. He's the Vice President of Detroit Recovery Project. He works tirelessly to expand recovery services and supports individuals in the Detroit recovery community who has experience. He also has experience in community health. He's a powerful advocate for accessible recovery services and community health, particularly here in Detroit. We have someone else on the panel. I haven't had the pleasure of meeting her yet, I don't think, which is Pamela Lynch. She's the Executive Director of Harm Reduction Michigan. It's an organization doing harm reduction advocacy and outreach in Michigan. She focuses mainly on improving public health through safer substance use practices, overdose prevention, and advocating for harm reduction strategies across the state. And last but not least, like I said, Aldeana Goodspeed. She's a leader in prevention and community health. She serves as a president of Steps to Life, Inc. and MAC Alive, where she works to provide essential resources for individuals and families impacted by substance use and mental health challenges. She leads community outreach initiatives to emphasizing education and empowerment. Aldeana, can I say a little bit more about you? Aldeana, when Aldeana and I met, we met kind of on the level because I had just served 23 years. Aldeana had a son in prison. She still has a son in prison. And I could only look at Aldeana and think of my mom. Because every day my mother walked out of the visiting room, where she came to visit quite often, she cried because she had to leave her baby there. And I never understood that. I never understood how much I meant to her until I went to prison. And she showed me then That's why I have the utmost respect for women. Because the things I put that woman through, and she never faltered. She's still by my side for those whole she passed. I came home in 2018, she passed in 2010, but up until that time, she was there. She did not waver. I was her baby, and I was 6'2", 220 pounds, and I was still her baby. I understand that now. So what we're going to do, how are we going to seat the panel? Okay, I would like to bring up the panel. Yeah, I'm gonna sit with her. I just want to meet Pamela because I've never met her. That's okay. How are you? It's a pleasure meeting you. Thank you, thank you, thank you. Yes, absolutely. All right. So what we're going to do, I think the panel is going to have 20 minutes, 15 minutes to have a discussion, I guess, or tell the audience who they are. So let's begin by discussing where we are today. Each of you has had I'm sorry, because when I turn my head, I forget to take the mic with me. So I'm going to talk to you. I apologize. And forgive me, because my voice is deep, but it's not loud. So you may have to say, put it up to your face again. Each of you have a deep experience in different aspects and perspectives of mental health, recovery, and harm reduction. We've made progress, but there are still significant barriers to success, especially in policy, funding, and implementation. We're eager to learn and hear about some of the biggest challenges you are facing in your work, and where you see the greatest barriers in accessing mental health and substance use services with harm reduction and community care in mind. Can you give us an overview of the current landscape of mental health and substance use support in Michigan, and what key trends or challenges you're seeing? We're going to start with you, Dr. Asabigi.
Yes.
From your perspective, what is the current state of recovery services and harm reduction in Detroit and the surrounding areas, and how have things changed in recent years?
Okay, thank you very much. I'm Dr. Kanzoni Asabigi, and I have some slides that I would like to show just to discuss where we are now and how we got here. And this is about following the money. So if you don't mind, I will stand a little bit. Okay. I just want to talk a little bit about, the funding and how services are organized in the state. Mental health, substance use disorder, and developmental disabilities are primarily funded by government. So we really, really need to understand legislation about policies and where the money is. Next slide, please. So in the past, mental health was organized by community mental health programs in the state. Some of them provided substance use disorder services in addition to severe and persistent mental health disorders. And then some parts of mental health was also carved out, what they call mild to moderate. I don't understand why, but that's how it was organized. And those services were provided by the Medicaid health plans for individuals. So all community mental health services programs, they had contracts with the state to provide these services. Next slide, please. So these mental health boards throughout the state were made of 12-member boards and they were appointed by county commissioners. Okay? A third of the board members were consumers and or family members. They're volunteers. They're not paid for this service. And they were accountable to government entities. Next slide, please. So since 1998, community mental health services programs have been responsible for management of Medicaid's specialty services. They had a waiver from CMS and authorized the first, and I underline, managed Medicaid specialty services. So I worked for HMOs for 15 years. So when I hear managed, I understand what it is. That is, you have authorizations and they're trying to save something, which is money. Services provided through a network of providers in each county. Next slide, please. So this is how the community mental health services programs were organized. A lot of them single counties, about 46 of them, but others were 2 or more counties. Next slide, please. And then we had what we call coordinating agencies. They were primarily responsible for substance use disorder services, and they were created back in 1978 through a public act and associated with public health departments. But over time, some of them became nonprofits. And the city of Detroit and a few others, like Genesee, the CS remained with the health department. So for Wayne County, we had 2 coordinating agencies, the City of Detroit Health Department and SEMCA. And they provided substance use disorder services, which include, residential services. They handle block grants also and Medicaid. So block grant for individuals that do not have insurance or are underinsured. Okay, and they had contracts with the state and some with the community mental health boards for Medicaid services. The one thing here that I will talk about later is prevention services. We don't have adequate funding for prevention at all. Medicaid doesn't really technically pay for it, but they do, provide funding through block grant, for SUD services, prevention services. Next slide, please. So, in 2012, under, the governor's direction, these entities were merged into what we now call prepaid inpatient health plans, or PIHP. And for Wayne County, I'm glad to announce that we have a representative here. Ms. Davis, Detroit Wayne Integrated Health Network, that's one of the PIHPs. So there are 3 single county PIHPs, Wayne County, Oakland, and Macomb. All the other 7 are 2 or more counties banded together. And they provide mental health services, severe mental health illness, again, mild to moderate mental health is provided by the HMOs, okay? And they provide substance use disorder services and intellectual and developmental disabilities services. Next slide, please. So this is how these entities are organized. I really encourage everybody to know all these PIHPs and where they are located. And they all are listed there with their numbers. You need to know these PIHPs if you or a family member or some loved one needs mental health services, substance use services, or developmental disability services. So those funds go through these PIHPs. Next slide, please. So mental health SUD services are technically not at par with physical health, even though there's legislation that requires parity. But we still have this inequities, if I may use that. So for individuals with full-time, some people, they have private insurance, but the insurance has limitations. You can only have certain number of visits or certain number of hospitalizations, but you don't have any control if you're depressed or you're suffering from, major depression or bipolar, and you're psychotic, and you have private insurance. That becomes a burden, for health insurance. And you can see it's very complicated how we organize these systems. And some people are underinsured. Next slide, please. So these are the services that SUD providers, the PIHPs provide, residential services, detox, and again, now medication-assisted treatment programs are expanding just because we have the opioid overdoses and also recovery housing. Next slide, please. This is something that we all should be on the radar of everybody. Certified Community Behavioral Health Clinics, or CCBHCs. So now, this is the model promoted by SAMHSA, and the funding is coming through for these CCBHCs. They are similar to FQHCs. I don't know if some of you are familiar with FQHCs. So this is really promoting one-stop shop, whereby people can get mental health, substance use disorder services, and primary care services. No wrong door model, integration of services. And Michigan is a pilot state at the federal level. So watch out. Make sure that you understand all these acronyms, because that's where the money will pass through. Okay? And we're talking about billions of dollars that will pass through for mental health and SUD services. We're currently spending, billions of dollars in these areas. Next slide, please. All right. So I just wanted, as an epidemiologist, dealing with numbers, just wanted to highlight what's going on with the opioid overdoses. Now you can see, and fatalities, I just want to show something because that's what we'll talk about with SSPs, syringe service programs. You can see at the bottom right there, a lot of overdose fatalities statewide occurring in Wayne County. Okay, next slide. And this is the distribution, demographics. I have 5 minutes. This is statewide. So you can just see that, blacks are disproportionately impacted. Look at Wayne County. We are all affected. There's no part. And you can see the majority of individuals overdosing are in the city of Detroit. Okay, next slide, please. And this is the distribution. This is Wayne County. Look at the race. Blacks make up 38% of the population in Wayne County, but they account for more than 50% of overdoses. Next slide, please. This is the fatalities. At least 2 people die a day from these numbers in Wayne County. Next slide, please. And again, I just want you to pay attention to this part here. Majority of people dying 55 plus, which is a little bit different when you look at national data and statewide data. Next slide, please. Yes, the numbers are starting to come down for overdoses and fatalities. Very, very good and exciting news. But from the data, you can see for whites coming down, for blacks, none. So a lot of disparities, and we just need to figure out what we need to do to get these numbers down. Blacks are dying disproportionately, when you compare the percentage of the population and these numbers. So I'll stop here, and we'll talk more about syringe service programs and what can be done about this. Thank you very much.
Thank you. Thank you, Dr. Asabigi. Okay, Dr. A, how's that? Is that okay? Okay, because I will mess it up. So next we have is Pamela. Pam, and your question is, as the leader of harm reduction, Michigan, how have harm reduction strategies evolved in Michigan? And what do you think is most effective right now in terms of public health approaches to substance use?
Hi. Okay, great. Mic's on. Hi, everyone. Thank you for coming tonight. It's an honor to be here. Thank you for inviting me. I started working for community health awareness. Well, I was a volunteer with Community Health Awareness Group in 1996 when Mayor Dennis Archer passed legislation that allowed syringe access in the city of Detroit. And he did so because of the number of people dying from HIV and AIDS. Well, from AIDS, sorry. So he was very, very smart mayor who was driven by science and data, and he could see that syringe access had a good impact on keeping people HIV negative. And so he worked with a number of people from organizations around the city and some researchers and put that legislation through. There were some strong advocates, Loretta Davis Satterla, who was at the State Health Department at that point and was able to coordinate some of that as well. No, actually, she'd left the State Health Department and come to Detroit Health Department. So today, things have evolved a lot. There are now many syringe service programs in the city of Detroit, Detroit Recovery Project, Harm Reduction Michigan, and Answer Detroit, another one who's here. And so it's important, some of the points that I want to make, and I don't want to go on about a lot of things, but want to make some important points, is that syringe access is not really about the syringe. It's about creating a trusting relationship and keeping somebody engaged with health care and with people who care about them, where people are treated with dignity and respect, regardless of their personal lifestyle choices. So maybe they're smoking a pack of cigarettes a day, or maybe they're smoking crack every day, or maybe they're shooting fentanyl. But they still are human beings that contribute as a member of their family, as a member of our society, and so that respect and care is what really harm reduction programs are about. The syringe is a nominal part of that relationship. So really important that people feel welcome and that they'll come for whether it's syringes or overdose kits or wound care or a referral to a food bank or clothing. Most of our programs do all of those things as well as treatment. We are also a recovery community organization. We're proud of that. So 90% of us that work for Harm Reduction Michigan are people in long-term recovery with lived experience ourselves. We also prioritize people with lived experience, so living with HIV. Most of our employees have personal experience in having an AIDS diagnosis or living with HIV or having had a hepatitis C diagnosis as well. So we're very much about nothing about us without us. Something Dr. Valerie said at the beginning is that, if you're not something about being at the table, and I've heard that if you're not at the table, you're on the menu. So, so here we are at the table. Thank you for that opportunity. In terms of the future in Detroit, there are some things I think are really important. Valerie Bonner mentioned this bill, that's House Bill 5178. Well, it's made its way, and this is decades after we first passed syringe legislation here in Detroit, right? So when the state of Michigan passed a bill for syringe access to be allowed, what they didn't do was add in some words that said, okay, so the bill said, yes, you can take clean supplies away from this program without being prosecuted in the best of cases, and when the law is being applied, and like Valerie said, in many places it's not applied. But what that bill didn't say is if you return used syringes that we can test for residue, we're going to put a new case on you. So this legislation that is now in the House for a vote includes changing it so that it includes people can bring back used syringes without looking at additional charges. I think that's a pretty important part of the bill. Okay? Now here's where you guys come in, where we all come in. We all need to call our legislator before Thursday because this is the lame duck session. Guess what? There's a lot of these guys who work for us, right? They work for us. Remember that. We put them there. Okay? Well, there's plenty of them that like to leave for Christmas break a little early. So the concern about this bill passing out of the Health Committee on Thursday is that not enough people will show up for the vote. So everybody in here needs to call their state representative before Thursday morning, so very late tonight. Call and leave a message on their office voicemail, or even first thing in the morning. We all need to call and say, please show up for that vote tomorrow. Because if they don't show up for that vote tomorrow, there won't be quorum, and it won't pass further out of the House. And will be stalled for probably another year. And next summer, they'll be talking about maybe in the fall. And in the fall, they'd be talking about maybe at lame duck, just like we've done for the last I don't know how many years. That's not okay. Again, they work for us, so let's please everybody make that effort to make that phone call tonight. Just leave a message, send an email if you can do that. So that was one really important point that I wanted to make. And then another really important point I wanted to make is if you can pop on that PowerPoint real quick. There's just a couple slides I wanted to show of our programming. We have had the grace in 2020. We were given a large grant by Bloomberg Philanthropy in New York City to do naloxone distribution. And so we were able to increase Narcan distribution in many areas of Michigan. Go ahead to the next slide. And so we have outreach workers who started in 2020 distributing Narcan to people who might be at risk or who know somebody who might be at risk. So please understand that Narcan is not enabling people. And everybody, please have conversations with your loved ones about having this tool around. And as we heard earlier tonight, you can have like the first degree of separation, somebody can have Narcan. But when people are using alone, they still die. Well, why are people using alone? Because of the shame. When people are ashamed that their family members might know they're dibbling and dabbling again, or they're at risk again, it's very shame-laden, right? And so we really want, and people, we've done a lot of trainings, and parents would say to me, well, what do I tell my person that I have Narcan? And I'd say, you know what? I'd say, yeah, tell them you've got it in the house. And that, please don't lock the bathroom door. We know this is a chronic relapsing disease. It's okay. How many people quit smoking cigarettes? On the average, you quit 9 times before you finally quit. That's the average for stopping tobacco, right? And so we have to remember that that's a common part of that challenge, right? And so we don't want to value people's sobriety over their life. We have to value their life over their sobriety. Let's go on to the next one. So this is just the first vending machine that was put out by Wayne State. They put them out in a bunch of county sheriff's offices because they know when you're coming out of jail or prison or treatment or detox, you have a 25% higher chance of dying of an overdose in the first 2 weeks because your tolerance has come down so much. So they actually put them in Jackson County jail and in the prison system so that people can get Narcan for their loved ones if they have a history of opiate dependence. You want this in your house. And at some treatment centers where we're passing it out, and people go, wait a minute, so you think I'm going to relapse? Is this what this means? No. We know that you may be in a situation where you could save someone's life. And that's what we want you to be able to do. Go ahead. So we need a lot more of these machines. we now are putting out these newspaper boxes, okay? Those big vending machines, they're heavy. I can't pick one up. When we got ours in front of our office in Baldwin, we had, you know, a truck and a forklift and very big men helping move it. So we now are using these little newspaper boxes. We needed something less expensive. We need a lot more. People need to be able to get to them 24/7, 365. Why? Because people are embarrassed to even have anybody know they need this medication in their house. I mean, I was talking to some girls in a halfway house in Flint who'd come to this big recovery rally last year, and they were worried about one of their roommates who they thought was dibbling and dabbling, and they said, oh, we need Narcan because if she goes out, we want to be able to help her. They don't have Narcan in this house. And I said, well, please take some Narcan. They said, we can't. If we take Narcan, they're going to think we're relapsing, and then they're going to send us back to prison. See what I mean? So it's like, you know, like people like are kind of scared to have it sometimes. Well, that's an indication there must be opiates in my midst. I don't want to get back in trouble, right? So anyways, but these smaller boxes, they don't need electricity. You don't have to plug them in anywhere, and they don't take up much space. Go ahead. So this is what one looks like. That's in front of our office in Manistee. Go ahead, sir. We can go ahead. It was posted in the Washington Post. This is in front of a recovery community organization in Flint. So many of the recovery community organizations across the state reached out to us to put them in front of their buildings because, again, people need access 24/7, 365. We have some other places that have put them inside. But, you know, when people want to show up at 2 a.m. to get some, or they don't want anybody else seeing them get some, they need to be able to get to it all hours. Go ahead. So with the support from harm reduction, or from Vital Strategies and MDHHS, we now have 224 of these boxes around the state. However, we do not have enough in Wayne County. We now, go ahead, please. And some other counties that have replicated the program are doing a great job. This is excellent. Genesee County has put them in all of the rest areas along all the highways, which is a great innovation. Go ahead, please. And so remembering that education is also key. So you can have all the Narcan in the house possible, but a true overdose, it's a lack of oxygen. In places where they have safe injection facilities, I was able to visit a safe injection facility last year. I asked the man, how many overdoses you guys have a day here? They have no fatal overdoses. He said they have about 16 overdoses in that facility on a daily basis. I said, out of those 16, how many do you use Narcan on? He said 3. Why? Because they have oxygen tanks. So you can't just Narcan somebody repeatedly. We got people panic dosing Narcan. You've got to give them rescue breathing. They need oxygen. Their heart can't pump if they don't have oxygen. So you got to do rescue breathing and Narcan. So that's a critical message that people need to get. And this has never been about data collection. That's one of the reasons I think programs don't, or administrators don't like it. Because, well, how many Narcan kits saved that person's life? Or how many people were actually saved from that box? We don't know. What matters is that it's getting into people's hands and that it's saving lives. And I had a woman, a doctor in Wayne County, say to me, well, we can't put that out. A person told me that she could sell a Narcan kit for $200. A lady of the night was her term. Told me she could sell a Narcan kit for $200. And I was, well, if she can sell a Narcan kit for $200, then there is not enough Narcan in Wayne County. Okay, all that's an indication of is a lack. So, data collection is challenging and will continue to be so as long as drug use and addiction treatment are inextricably linked in this country to the criminal justice system. People aren't going to call 911. Why? Because they're getting locked up when they call 911. So we want people to have the tools so that they can save their loved ones, they can save each other. Go ahead, please, sir. And then we were just grateful because on Facebook we saw this post on July 4th, God bless America and God bless Harm Reduction Michigan. People are grateful to be saving their loved ones. Go ahead, please. So this is at Corktown Health. And my other point that I want to make, go ahead, please. Hamtramck, Trixie's Bar. So we have these, go ahead, please. We have these outside, strip club in Lansing. We have them outside of coffee shops, restaurants, health centers, domestic violence shelters, food pantries, churches, every weed shops, there's a lot of people in the weed industry who actually got out of opiate dependency by using a lot of weed. I had no idea. I was like, oh, hell no. When I was opiate dependent, you're going to tell me I could use weed? No way. I wouldn't believe it for a minute. At first, I didn't believe it because I thought, oh, no, But now I've heard so many people talk about their success with that. So my point in this is the state has just given us money for many, many more boxes. If anybody in here knows a barber shop, food truck, anything where you want to put a Narcan box and you have the authority, or you can get the authority to place that Narcan box, have as many as you want, just leave your card or your contact information with me, please, sometime tonight or tomorrow, and we will get you a box and all the free Narcan you could ever need. Go ahead. So, go ahead, that's just more about the addition, 800 boxes to be placed in the next 2 years. So, and we know that overdose death is coming down. We think it's due in part to, it's a lot of things combined, but this is one of the reasons why the state offered us the funding to put out additional boxes. Go ahead. And that's just my contact. So, thank you.
Pam, thank you so much. Actually, that was very interesting. Yeah, we definitely need to talk, because I didn't know any of this. Next up, Aldeana, this is your question. You work in both prevention and recovery. How do these efforts align in the current landscape, and where do you see the biggest opportunity for improving outcomes?
Hello, everyone. My name is Aldeana Goodspeed, and I am the president and CEO of Steps to Life Incorporated. I also work with Mac Alive, and I also work for another organization called Share Incorporated. I've been in the field of substance abuse since 1987. I'm a person in long-term recovery since 1987. And, you know, when I look at the progression or the progress of substance use disorder, and I'm listening to all of the help that is available, like the Narcan, the passing out of syringes. They didn't have all that back in the day. If you overdose, like I did many times, they threw cold water on you. They put you in a bathtub. They shook you up. They did in a shower. They did whatever they had to do. And if all else failed, they put you out in the alley. You know, so now, you know, we're looking at prevention. We're looking at look at this as not a crime. It's a sickness. It is an illness. So since God spared me to be on this side of the fence, I have dedicated my life to helping someone who may be struggling in that area, in that arena. And where do I see this going? I see a lot of progress. And, you know, at one time, I used to have a different mindset about substance use disorder. I used to think that there was only one way to recover. You stop using cold turkey, and you don't look back, and you move forward. By the grace of God, I made it that way. Now, there are multiple ways, multiple pathways to recovery. And just like you were saying that, you know, sometimes people use marijuana to get off one drug. It's legal now. It wasn't legal back then. So at this point in my life, I'm like, well, whatever helps you, the goal now is to meet a person where they are. If this is what it takes, okay, I am going to walk with you. And in my field of mental health and substance use disorder, I have recently become a recovery coach. And this is helping a person to learn how to put down the drugs and to lead a productive lifestyle. And one thing that I wanted to talk about too was the fact that right now with this drug epidemic, it's like the house is on fire It is so, it's just like with all the statistics that Dr. Asabigi presented to us, it is just like it's everywhere, but there's help available. But what can we do to prevent it? I'm into prevention, and there's not a lot of funding that was mentioned for prevention. But if we start at a young age, I think that all the curriculum that they have in schools, there should be a substance use disorder. There should be some kind of curriculum to teach children how to not use drugs, just like they had cooking, they had sewing, they have gym. It should be part of something to educate them. I have a granddaughter, and I have a great-grandson, and we often talk about substance use disorder. They know my background, and they know where I stand on that. Sometimes my granddaughter asks me, she said, "Grandma, can we have a therapy moment? Can we have a moment so we can just sit down and talk about what's really going on?" And as we discussed in the lobby, a lot of people are dealing with co-occurring disorders. There's substance use, of course, yeah, that's the tail end of it. But what led it to substance use disorder? There are some underlying issues that needs to be addressed. Anxiety is posted all out there. Anxiety and depression. How does a person deal with that? In the line of business that I work in, I meet people and they come in. I would say 98% of the people that I serve deal with anxiety and depression. And there are other issues as well. Could be some psychotic disorders, but it's usually anxiety and depression. And also, I want to say this too, because I didn't bring my slides, but I did bring some handouts. Grief and loss. Grief and loss is, and trauma is one of the other main issues that people deal with. Unresolved grief and loss can lead to substance use disorder. So I say, let's get to it. Let's nip it in the bud before it even escalates to a point where a person feels like they have to put a drug on it in order to cope with their emotions and their feelings. I meet people every day, and that is something that needs to be addressed at a young age. How do you deal with it? Because, okay, when I started using, I thought back in the day, and that was back in the 60s and in the 70s. In the 60s, you know, you had the riot in the 70s, and then you had the heroin, and then in the 80s, you had crack. You know what? I thought it was a good idea. I thought everybody in the world should get high off of something because it just made you feel good. That was my philosophy. That was my mentality. I was a child at that time, and they say when you are a child, you think like a child, you act like a child, but when I became an adult and I educated myself, that was not the right way. But people are influenced by peers. People are influenced by misguided information, and they get caught up in the wrong trend. And so it has to be some type of education that is imparted upon our youth. And maybe it may not come from the household that they live in, but it should come from other organizations, and particularly the school system. And that is something that is in the future. We're looking at a paradigm shift. Right now, the house is on fire because there is a big issue with substance use disorder, okay? It's prevalent, it's everywhere. But if we could nip it in the bud and teach our youth, okay, in a school structure, in a setting, or you could come to Steps to Life Incorporated. We're located at 3746 Fisher Street at the Mac-A-Live facility. We are just a small organization that help people individually, we help groups, and from time to time we get a little funding to put on some events, but we also offer grief and loss, and that class, it should be full to capacity, but it's not. We get people that come in from time to time, and then some keep coming, and then some don't come back. But we need to get the word out there that there is help available for people who need some help. because what we say, get it up and get it out. Sometimes, you know, you cannot deal with a lot of feelings that you may be having, and it's a good thing to come to someone and talk. My background is I'm a mental health therapist, but I'm in retirement now. But I come out of retirement from time to time and talk to people and provide services as needed. With the Grief and Loss Support Group, listen, unresolved grief and loss or unresolved issues that you may have, it will haunt you and it will make you feel like you need something. Maybe put a drink on it, put a drug on it. You don't feel anything, you don't have to deal with anything, and then there goes that vicious cycle. So, with the programs that we offer, Steps to Life Incorporated at Mac Alive, it is a lifesaver, and we are just a very small organization. Steps to Life is, we partnered with a larger organization to provide some services that are definitely needed throughout our community. And so how I feel things could improve is, I think that a curriculum in a school needs to be started. I think that people need to come out and be a part of this convening process to just point out things that are needed, what is needed. I am so pleased to be invited here, and Sheba, thank you very much, and the Detroit Justice System, thank you so much for inviting someone like myself, just a person born and raised on the east side of Detroit, caught up in the system of substance use disorder. And also I have a son who is incarcerated, and he's been incarcerated for 23 years now, and he'll be on the program tomorrow. And there is a second look legislation that is on the table, and I am hoping and praying that one day he'll be home just like you and maybe a few of you here. When I see people who have been incarcerated for long term, it does my heart good. It touches my heart to know that you were there and now you're here. And what I see, most people who have been incarcerated and they come home, oh, they take off like they are just flying. They are soaring, making progress. They're doing some things. And, you know, I commend the people who have been incarcerated and come home and help the community. It's definitely needed. I commend the people who have used drugs and have made a change. And my supervisor, Miss Artina Hartman, she just arrived. I'm glad you came here. I love this person. I love this person to life. She used to be serve as a state representative. She was on the parole board, and I remember when Steps to Life had nowhere to go. It was just a vision and a thought and an idea. And I went over to Mac Alive, and I presented my vision to Miss Artina Hartman. She said, I like that idea. And she opened up the doors, and she allowed us to come in and have all the support groups that we could possibly have, that we could possibly think of. And we've been in partnership since 2020. And that was during COVID, when it was hardly, thank you. That was during COVID, when there were hardly anybody opening up the doors, but Mac Alive had their doors open. And we have the substance use disorder groups, we have relapse prevention, we just started a Nar group, because oftentimes when a person has used drugs and they put their family members through pure hell. And just like a person is addicted to the drugs, a family member is addicted to that person. And they go through a lot of changes, and it's hard for them to deal with that alone. So, it's a 12-step program. Nar-Anon is. Nar-Anon, Al-Anon, NA, Narcotics Anonymous, Alcoholics Anonymous. Listen, if you need some help, listen, we are a small group, and you just come on over there. We need some help. We need some resources, but we're going to keep moving on regardless. And I am so grateful to even be here, because possibly I probably shouldn't even be here, all that I've been through. But I figured that if God brought me through this far, I'm going to keep on going. Whatever I can do to help another person, I am definitely going to do it. I've worked at just about every treatment facility they have in the Detroit metro area. I've worked in various organizations to help different people, and I plan on to keep on doing that. And I'm sure my time is up.
We got
by now.
about
Okay.
30 minutes. I didn't want to cut her off because everyone was enjoying it. But I would want to say this before we get to the next questions. One of the things that I've learned coming home, like Aldeana was just mentioning, a lot of us and some of the brothers here that I know were away when I was away, we do come home, start off running. But 9 times out of 10, we're running from ourselves. We're trying to make up for lost time. And no one tells us to slow down. Take your time. Get reacclimated. Because when I came home in 2018, I left in 1993. It was still 1993 when I came home. Things had changed. And in prison, you want to stay out of your cell, so you'll volunteer for everything. And that's the mistake we make when we come home. We want to volunteer for everything, not knowing that sometimes people use us. They use us for our story. They get the money, we get nothing. And we're, exactly. And so I would, exactly. I would encourage, I hope your son gets that opportunity, because a lot of people have come home doing life bits. But I would encourage you, if he does, to tell him, baby, take it slow. Take your time. We're here. Because y'all gonna have to learn each other all over again. I know you go to see him, but you don't know him. And he has to get to know his mom all over again, because he was young when he left. He's a little older now. Okay, that was my story. Okay, so. Cool. You want me to start that now, Sheba? Okay, so I tell you what we're going to do. We're going to start a Q&A with all of you. Okay, somebody say something. Say something. Yeah, we want to hear from you all too. Ask the panel anything, because I have a few questions I want to ask. Does anyone want to ask anything? No, I'm volunteering. I'm voluntoling y'all now. No. Come on, Eladio, what do you want to ask?
Question is for Aldeana. What was your turning point when you left addiction?
My turning point, they say that in addiction. My turning point, they say when in addiction, you have to hit a bottom. You have to hit a bottom. And I had pretty much lost everything. I did not lose my children by the grace of God, but I hit a bottom where I was mentally, spiritually, and physically bankrupt. And I knew that my life would not end like that. I always knew, I felt in my heart that it was a better life, because my drug of choice, it started off with marijuana. And then I started with pills, amphetamines, and then I started with heroin. And when I started with crack, that is a device of Satan. And I said, it's gotta be a better way than this. It takes everything that you have short of your life. And that was my bottom. That was my turning point. And you know what? Although that was a device of Satan, it was an eye-opener that God had something better for me. Thank you.
We have another one.
Thank you so much, panelists. I'm going to try and use my words carefully here. I would like to hear from the panelists what they are doing, and perhaps maybe other service providers are doing in our community in order to safeguard the work that we do in anticipation of the upcoming administration, if you know what I'm saying.
Yeah, thank you very much for the question. And I would say that we need to impress on any administration that syringe service programs are low cost, high impact public health activity. That means it doesn't cost a lot, but it does a lot for the individuals and the community. So, you know, purchasing of syringes and needles don't cost a lot, but it saves lives. How much does a life cost? We don't know, you know. So that is one thing that we need to do. We also need, you know, to present the data. Data is not everything, but data visualization is very important. When people see things, it registers. And I think that, you know, for syringe service programs, we need to promote, you know, the stigma is still there, but it's not as it was, you know, back then, several years. But it does a whole lot of, it has additional benefits. You know, people don't, you know, with syringe service programs, used needles are collected, you know, in containers. So people don't just throw them away in the park where kids play, and you know, they can get a hold of these needles. And then what we do is just make sure that, you know, we continue to educate the community. We need to educate the law enforcement. And I have, you know, a history with the Detroit Police Department because they have a high turnover, not because people are leaving, because people are retiring. They get in there 19, 20, and then 30 years, they reach full retirement and they leave. So I think Valerie talked about, you know, harassment of syringe service program staff, you know, arresting people with, you know, the kits that, you know, the programs give them. So just educating the community and getting support, I think, will be very helpful. And also just keeping our ears and eyes open about, you know, changes in legislation, where the funding is going. I think we need to be aware of that and be intentional about what's going on so we can also have an input about where the resources are going. Thanks.
Thank you, Dr. Hay. I think we have time for one more question. Can we keep it brief, and can we keep the answer brief? Go ahead.
Hi everyone. My name is Elijah, and I got a question about police and their knowledge on mental health. I was in GRI, and I was in a hospital for 10 months, and I was abused by the police in jail, and also before I was accused of the crime. So I want to know about what we can do to help police and their knowledge on dealing with mental health, and also the time people spend in mental health hospitals, how to develop whether they're a risk to themselves or others more accurately, so they're not spending years and years in mental hospitals.
Who wants to answer that?
Thank you very much for the question, and this is really very important. Somebody mentioned that, you know, the jails are full of individuals suffering from mental health. 25% of individuals in the jails have severe mental illness and can't even function independently. So why are they there in the first place? But to your question, yeah, we have come a long way. I know for sure the PIHPs are doing a very good job working with the police department. I know for sure that Detroit Wayne Integrated Health Network is working with DPD and some county, Wayne, police department and law enforcement, but a lot more work needs to be done. And they're being provided with training about mental health disorders, how to de-escalate, situations, because that's usually where the issues come up. You know, they don't know how to de-escalate. What, you know, the adrenaline is pumping, and so they want to show, you know, for lack of a better word, how macho they are. And, you know, so training is very important. It's not every situation that should lead in a handcuff or some, you know, taking somebody to the jail. I recall, you know, the health department, we had 2 DPD, the Detroit Health Department, assigned to the Bureau of Substance Abuse. And they were with us all the time. If we had a situation, and their role was not to arrest people and send them, you know, to jail, but we need more training, and we need, you know, community involvement to just make them aware of this. And, you know, there have been shootings, you know, for individuals that are mentally ill. That shouldn't have occurred, but there are different pilots, and I know that, you know, some PIHPs, like Detroit Wayne, they have counselors going on some patrols with the police officers. So I don't know how effective it's been, but at least it's the first step.
Could you take one more question right here? I got a brother right here want to ask the question.
Do we have one more? Go ahead.
I just want to piggyback off of that. Like, what exactly does that solution look like? The reason why I ask is because I currently stay in a rooming house situation, just a bunch of random college folks and young professionals or whatnot. I had a tenant that was on the verge of being evicted. She got notice of being evicted. She had a whole mental health breakdown, PTSD, scripted out, all that good jazz. And when I called DPD, I had to call them 3 times within a matter of a month, within her 30-day process. And each time I called, I told them, I don't necessarily want y'all to send cops, but if you have to, fine, I need a mental health personnel. Can you bring one of those from your department? And they told me those don't exist. And that's DPD. I live on the west side, Dexter, to be exact. So my question is, what is this training supposed to look like? Because it's not being implemented, at least within the last month. I called 3 times to DPD and told them, I don't need y'all to come arrest this woman. I need y'all to get this woman some help. I'm not, even though I'm a CHW and I also do community health work as, on a mental health part, I'm not licensed to give a petition to have this person petition into getting help. And of course, we can't force nobody that want to seek the services themselves. So what does that help actually look like?
Hi, and
Hi.
thank you for that question.
Welcome.
Let me just introduce myself, and I'm going to be very brief. My name is Judy Davis. I am the Substance Use Disorder Director for Detroit Wayne Integrated Health Network, which you have heard some information from Dr. Asabigi regarding some of the services that we provide. So currently, I don't know, it's been in the news a lot, but we currently have a new CEO at Detroit Wayne Integrated Health Network. And that CEO is Mr. James White, who was formerly the chief of DPD. We have worked with DPD very closely in the past, providing what we call CIT training. These are crisis intervention team actually work with the DPD, providing at a minimum 40 hours a week for those individuals to receive training as it relates to individuals with mental health. In the event, we also are working with DPD on their 24-hour line where people call in for emergency, they 911 line. So we have someone actually on those lines. So in the event they receive a call, that we have some individuals that provide those services as well. In the event that you're not getting any services, you can call our 800 number, which is available 24 hours a day, 7 days a week. And we have a crisis team that will come out to you and provide those crisis intervention services. And I just want everybody to have this number. Again, I'm going to be very brief. It's 1-800-241-4949. And again, that number is available to anyone who needs our services 24 hours a day, 7 days a week. Our doors are never closed. So, thank you.
Thank you so much.
I'm sorry, 1-800-241-4949. Thank you.
Thank you so much for answering that question. And thank you all for coming too. Go ahead. Yeah, so we're going to get ready and close this. Thank you all for coming. This is a conversation I know we can have forever because this is so important. I don't know if the young man, if he got the answer that he was looking for, but I'm hoping he'll at least contact someone. Okay, if that's all you have to provide, I don't know. But listen, we're going to close up right now. I would like to congratulate the panel, and please give them a round of applause for being up here. And thank you all for coming up and telling your story. And we will see you again.